Hello, my name is Miss Nikki and I'm going to show you PPE, okay? As you know, there will be times you have to wear PPE and you are not immune. Just because the nurses and doctors and you think you're a phlebotomist, you don't have to do it. Of course, you can get the same diseases anybody else can. So I'm going to teach you how to put on your PPE or your gown and gloves, and then I'm going to teach you how to take it off. So it's called don and doffing. They put the D in the front, so don means on and doff means off. So if you take the D off, it's on and off. All right, so I'm going to don this. This is just a regular PPE gown. It should be splash resistant. So the reason why I have this up in the air is because it should not touch the floor. Think about we need to reduce the risk of infection for you and exposure. So I want to keep it off the floor, especially in a hospital setting or any setting. All right, so now what I want to do is I'm going to take the top of my gown, and you want to make it snug. Okay, so I'm going to take both of the strings here as soon as I can find it. Both of the strings, and I'm going to tie it around me. Now sometimes you put a gown on and you're doing it really fast, and you still have a lot of a give in the front. Also, of course, you would have your hair pulled up as well. So I'm going to tie a bow back here, and as you can see, I'm trying to really get this nice and snug around me. And then when it comes to the back, you want to make sure that you cover your back as much as you can. If they don't have the right size PPE for you, gown, then you need to put two gowns on, one in the front, one in the back, so you're fully covered. All right, what I'm doing right here is making a bow out of this because I want to take this off and I want you guys to reuse your PPE. Okay, so I have this on, I'm nice and covered, and now I'm going to take each glove. There's no really way to put a glove on, but you want to make sure that when you put it on, you have the wrist area covered. Now, as you see, I put that on, and if I was going to, let's say, do venipuncture, and it's in an isolation room, look at the exposure I have here, okay? So, if I wanted to tuck this in, I could still have exposure because this can just come apart. It's very easy to pull up. So what I like for you guys to do, if you can make a hole into this if you like. If not, you can just put your thumb in, and then I want you to cover up all of this, all your wrist area, and down. And you see that's not going anywhere. Okay, so that's the difference. Now, you know that your hands, after you're finished, is the dirtiest part. You've been cleaning somebody up, or you've done phlebotomy and you've drawn blood. So you do not want to put your hands to your face with these gloves on. So if you think about that, the first thing you need to take off is your gloves. So the way I do it is quack, quack. So this is a little duck, and it's going to bite my hand. Okay, so here's the beak, and I bit, and so I'm pulling this off, and then look, he's chomping it up, right? So now it's completely in my other hand. Now I'm going to pull this off this way, and now you don't want to pull the whole the glove off like this, because look, I've just touched the inside. So you want to pull down from the fingers, and of course put it in your biohazard container. All right, so that's what you want to do. Next, you want to take off your gown. So remember, we tied these in a bow, so we can take this back off. And I'm untying. And just so my string won't touch the floor, I'm going to do that again. Now, here is where people mess up. Okay, so I've untied, and then so you don't need to touch the outside of your gown. Remember, there can be splashes and bacteria and what have you. So what you need to do is you want to pull this off, okay? Now I'm inside. Do you see this? I'm inside my gown. This right here, you want to pull from here and put your hand inside. And then all you want to do is put your hands together like you're washing your hands, and roll this away from yourself. Roll it away, and then of course dispose it in your biohazard trash. Next, let's talk about how you wash your hands. You really, if you have water and soap, the best way to protect yourself against bacteria is washing your hands. Now you can look at it like you have grease on your hands, right? So how do you get grease off? Do you really rinse grease off? No, you want to use some kind of solvent, like some kind of detergent or soap, to really vigorously take that, take that off. And you can watch hand washing in the next video. All right, so let's say all I have is the hand sanitizer. So we want to rub very briskly, just like you would do when you wash your hands. And you don't fan it in the air to let it dry. You're nice and done when all of it is dry.